happened in New Zealand when COVID-19 struck? Well, initially in February of 2020, New Zealand implemented the sorts of policies that were consistent with that 2017 pandemic plan and that we were seeing around the world, such as, screening travellers that were arriving from certain locations, such as China, and advising people to, see their health professional if they were having symptoms. But it quickly became apparent that, COVID was probably likely to hit New Zealand with a bit more force. And at first, the messaging coming out of the government was that, well, New Zealand, it's an OECD nation. We've got a world-class health system, and we'll be able to cope with this onslaught. But as events in Italy, Spain, New York, and so forth started unfolding, it became rapidly apparent that New Zealand's health system was not up to scratch. We had nowhere near enough intensive care beds. The Ministry of Health didn't even employ any epidemiologists. There had been decades of neglect of investment in public health infrastructure. And really, things were looking pretty grim. This is when we only had 3 cases in the country. So what happened is the government decided that we needed to buy time, we needed to prepare ourselves, and the border was closed, even though that was not anticipated in pandemic planning. But there were already cases in New Zealand, albeit there weren't going to be any more arriving because the border was closed, and the border was separated from the country with a mandatory 14-day quarantine facility, which was managed by the government. So new cases weren't likely to arrive, but we needed to track down and isolate and eliminate all the cases that had already arrived. And this is exactly what happened. So a lockdown was implemented in order to prevent further transmission. A very strict lockdown. People basically had to remain at home unless they were out exercising by themselves or buying food. Test and trace protocols were developed, and all the cases in the country were basically found, isolated, and eventually on May the 4th, New Zealand had 0 cases. And during that period, the government strategy had pivoted from a sort of a suppression strategy or a mitigation strategy to an elimination one, when it became apparent that elimination was actually going to work. And so what we see in this figure here is a trace of the government's restrictions, the stringency of the restrictions over time. The blue line is New Zealand, and I've put in the Netherlands there as well for comparison. And what you see here is in March of 2020, New Zealand implemented these very strict lockdowns, more strict than what was going on overseas. But we were able to release those lockdowns relatively quickly because there were no cases remaining. And for the majority of the 18 months subsequent to that, there were very few restrictions in New Zealand at all. And this is because when cases did leak through the quarantine system at the border, lockdowns or large increases in the restrictions were implemented rapidly, and the cases were eliminated again back to 0. And this happened on multiple occasions. So it was clear that this method was actually successful in eliminating a disease like COVID-19 whenever it emerged, within the country. And we'll just ask you to hold that thought, because that's relevant to the emergence of this sort of epidemic, at its origin in general. So look, to date anyway, New Zealand has suffered only 28 deaths from COVID-19, and that, to put that in context, a country like Ireland has a similar population to New Zealand, and it has suffered, I think, in excess of 5,000 deaths. So the health outcome from this approach was very good. And just to highlight some of the success factors there, the border closure was clearly key. It ensured a low caseload at the outset, and that contact tracers and testers could manage with the number of cases that were already in the country. And that ongoing use of brief, strong lockdowns, strong public health measures, which may be considered by some as an overreaction, but they worked very quickly and effectively. Another factor that New Zealand had going for it, which I'll return to later when I talk about the idea of island refuges, is that there's a strong social cohesion within New Zealand. There was very much this sort of what was known as the team of 5 million approach. And for the majority of that period of time, people were supportive of the approach, and there was consensus that this was the right approach.